We do enjoy our Pat chats, don't we, Pat?
Yes, we do. And actually, I always live in horror, actually, that nobody's going to turn up, but actually everybody does. So look, thank you very much for joining us.
No, it's wonderful. Thank you for allowing us to do this, because it's so, there's always something, isn't there?
Yeah, always. Yeah, absolutely. There is always something. What would you like to talk about today, Lisa? And also, throw it open to any and everybody to ask questions, as always. And bear in mind, there's no such thing as a daft question, because if you're wondering, I wonder what Lisa and Pat think about this, other people might be as well. So don't hold back. Please ask us questions. And Lisa and I will just gibber on and hopefully share with you some of our personal experiences, some of our thoughts, some of our ramblings, and see where we go.
Yeah, thank you, Pat. Yeah, so as always, you kind of go, what's been going on in Lisa world? And it's like, obviously, for those that know me, for those that don't, I do go around and visit practices.
Yes, well, that's really helpful, I think.
Yeah, it's certainly, and it's never done in a judgmental way, and it's just, sometimes it's reassuring to know that we've all got those same struggles. I wish we didn't have struggles, but challenges, should I say, instead.
Yeah.
And it is one of those things that, because I know we bang on about it, but because compliance is a living, breathing thing,
Yes.
it's just a cycle of constant just trying to do our best with it, isn't it? A lot of the time. But
Yeah.
there's been a few things that have kind of cropped up on my radar over the last month, and I think we've proven the fact that if it does pop on my radar, it's probably popping up on other people's radars.
Yes, exactly.
But
Yeah.
anything that's been a little bit different that you feel that you guys can share with us all, please do, because the idea of these sessions is to kind of talk about what's going on out there. One of the things that has been on my radar is practices that are doing a really good job of compliance, but it's still a little bit chaotic. And I think most people do feel like that to some extent.
Yeah, I think so. I think it's kind of inevitable that in some form, and I think there's always this constant fear that you don't know what you don't know. And so, you're pedaling fast to do all the things you do know about, but then there's this fear, what if there's something I don't know about and I've missed something and something's come along and I haven't seen it. And I think, I mean, you would expect me to say this, but I think putting a compliance system into place can help reduce the chaos, and does help reduce the chaos, I think. And try our aim at Dentistry Compliance is to keep things as simple as possible, because if you simplify everything, then it reduces the opportunity for complete chaos everywhere. And I think quite often practices get terribly bogged down in more policies and paperwork than they need, but because they don't know what they don't know what they can dump and what they should keep. So it's a constant challenge, I think. But I think this isn't a sales presentation. It's all about practices doing what's right for them, and there are other solutions out there. If you don't have a compliance solution, then make sure you have a demonstration of all the compliance systems so that you can see which one suits you best. But I think having a system reduces the chaos without a doubt. Do you agree with that, Lisa?
Yeah, and I think it's familiarity, isn't it? Kind of, there's still a lot of practices that have got some things paper, some things on.
Yes. Are there still a lot that have only paper? Are there? And is that because they prefer to do it on paper, or because they don't have a system, or they want a hybrid system, so they do some on paper and some on electronically? What do you think it is?
It's a personal preference. It's who's doing the bulk of it, who's doing the filing of it, that kind of thing.
Yeah,
There's some, I wouldn't even say it's a generation thing. I think it's just a, you know, some people, you know, feel very much more confident about it being completely digital, and then
yeah,
others.
yeah.
I'm one of those, and Jilly, who's in the background here, who does my
Yes, yeah,
compliance.
yeah.
You know, we do love a little bit of paper occasionally, and I just
Who
think
doesn't?
both, you know,
Mm.
having your files in a zip file ready to ping them over to whoever needs them, is great. And particularly HR files, I do love, I'm not allowed in the filing cabinet because that's Jilly's domain and I mess it up apparently. But I know Jilly loves, she hides the key from me.
Yeah.
I completely respect that. She's fine. So I think it's, as long as you know how to get your hands on things very easily, I think
Yeah,
it's the crux
yeah.
of it. So if you don't feel that you're the most digitally techno, you know, skilled person, have some, you know, there's no real crime in having a bit of both at all.
No, none at all. None at all. And actually, there's no real crime in having all paper if that's what you want. And I think some people still do. It'd be quite interesting to see of our people who kindly tuned in today, how many do paper, only paper. Is everyone willing to sort of pop in the chat line what they do? That might be quite helpful to see whether just no rush to do it, but just over time, just pop in the chat box. Oh, mixture of both, says Lynn. Yeah, I think mixture of both is quite common. Yeah, and then somebody else voting for both. Keep them coming. More paper. Yeah, okay. Electronic with printed copy. Yeah, this is really interesting.
I think one thing that I noticed recently, when we were visiting a practice, was there was a bit, they were very digital, and they found there was a member of the team that had left, not under particularly great circumstances, and that member of staff had gone onto their part of the compliance system. This wasn't your one, it wasn't Dentistry Compliance, and had taken off and deleted all of their information, so the practice didn't have any records.
Really? I didn't. Can you
Yeah.
do that? You can't do it on our system, but that's scary, actually.
Yeah, so the owner was kind of, get it on paper, which
Yeah,
you get.
yeah, absolutely. It's
It,
very interesting what our audience, our delegates are saying, though, isn't it? Because there is a definite wanting to continue with paper and not do only digital. This is really, really interesting information. Thank you all very, very much. You know, and in terms of making sure products are really what people want, then I think this is incredibly valuable feedback. So thank you all.
I think if somebody does have a system, you know, it's worth checking if a member of staff were to leave, and I'm sure we've all experienced
Yeah,
members of staff that have left, you know, or we've asked them to leave or whatever, not so, you know, amicable perhaps situation, what they have the power to do. Now, for me, if it's not amicable, I think you need to be protecting, you should be, from a GDPR point of view, protecting your records, because they're our legal records.
yeah,
By all means, they can have copies of things if they request it. I don't think anyone would be difficult about that. But I think you have to kind of make sure that you're protecting them. I think from a GDPR point of view, that's going to come into play if they're able to delete their own records. And particularly in some systems, the HR systems, very, very much, you store everything on there. So yeah, I think that's really interesting. Go and have a look if people will have the power to delete themselves, and therefore
Absolutely. So this latest one, sometimes with everything digital, unless you've notes and logs, you've stored. Well, yeah, okay, yeah, that's very interesting and helpful. Now, of course, when it comes to HR files and paper versions, absolutely, I get that. You know, you get DBS, you get Hep B, you get CVs, you get all of this stuff. What's really, really important with personal data and quite a portion of the data we hold on staff and patients is sensitive personal data. So that's things like medical history and things like the protected characteristics. And you've got to make sure that those are stored securely. So I've been into many practices over many years where they say, oh yes, everything's stored in a lockable filing cabinet. And you say, oh, is it locked? No, we've lost the key, but it is lockable. and so that is not secure storage. So, you know, Karen's mentioned about GDPR, and that's really, really important, because GDPR is all to do with personal data. And obviously it forms part of the Data Protection Act. So, and it's very, very important that all sensitive personal data and all personal data, so personal data is anything that can identify you, so that be your name, address, probably even your telephone number, actually, email, all of those things add up to be personal data. The other things like medical history, ethnicity, and so on are sensitive personal data. And that must be kept securely. So if it's kept electronically, it must be password protected. The password must be individual to each person, and it should be restricted, access should be restricted for all types of personal and sensitive data, should be restricted only to people who have the need to see it. So if it's patient records, for example, then the dentist, the hygienist, the therapist, the dental nurse need to see the records. Does the cleaner need to see the patient's records? Absolutely not. So there are different types of protection for different types of data within the practice. Personnel records for the team, really only whoever looks after HR, probably the practice owner and the practice manager need to have access to that. It shouldn't be accessible to anybody else. Oh, right. Okay, now this is interesting. My owner makes sure we all have the same password. No, that's an absolute GDPR no. So my owner makes sure we all have the same password, so we all can log into everyone's account. That should be completely forbidden. That is not allowed under GDPR. So everyone must have their own login. Should be really ideally a practice login, and you must have your own password. Never share your password with anybody else, and change your password frequently. So you should never be able to log into somebody else on somebody else's behalf. That's really, really important.
I think the only thing to add there, Pat, is if you have a work email, then people should have their own password, but then there needs to be a person that's able to retrieve that if a person leaves, or there are even then you have to have a valid reason to be going into that and looking at it. But hopefully most of the time you'd have a very nice handover and things like that. But I have seen it when it's done very wrong as well.
Yeah.
But that's a tricky one. Well, it's not tricky. Have different passwords and have the owner just know whose they are if that needs
that's not allowed under GDPR.
You could get into quite a bit of problems with staffing if they
and also I think in terms of patient records, it needs to be really clear who has seen the patient and who has written the records. So you need to make sure that if the nurse is writing the records, then the records are attributed to the nurse. Obviously, the dentist still takes, or the hygienist, therapist, still takes overall responsibility for the records, but it must be clear who's written the record.
We've had 2 instances I've come across where we have needed to rely on getting, in this case, both cases it was SOE exact, where we have need to look at who has accessed these patient records. Why?
You have what, sorry, Lisa? You what?
We've had to do some investigations in practice where something's happened, and we've needed to look at how, why, and when somebody has, because everything digital leaves a footprint. We know this.
Exactly.
Everything. You know, you only have to you only have to mention you're looking for a new pair of shoes, and suddenly you bombard
once it's out there, the internet never forgets.
No,
it's there forever.
I think that's, and we actually had quite a serious case that we were helping out with, where we needed to look if somebody had kind of illegally gone into notes and changed them, and we were able to get that footprint. So it's a good thing as well to make sure that everybody has their own logins, because sometimes the more
definitely,
the more we are reliant on it to back us up with things if needs be. It was quite a bit of a legal case as well, so please make sure that, you know, it's like teaching someone how to do your own signature.
Absolutely. So going back to what you said initially, Lisa, about chaos, what is it, do you think, that chaos within compliance system, well, not systems, but chaos within the compliance in practices, what is it, do you think, that causes the chaos?
I think it's one of them things we've said about, you know, we all love a bit of paper, but then at the same time, it does need to be meticulous. You do need to be able to put your hand on it very quickly. You've got your
I see what you mean.
Which is massive. Your fire protection folder, your everything. There's a lot of paperwork. So I'm not saying have it all paper, but whether it's digital or it's paper, you have to learning how to navigate, store, file, and find a certain document is as important as having it done sometimes.
Absolutely. Absolutely. Definitely.
It needs to be effective. That is something that, you know, one of the words that's rammed down our throats quite a bit. It has to be effective. And you've got to show that, you, like you say, Pat, you're doing the right thing at the right time. And I just think making sure that you find a system that you're comfortable with, that you can navigate around. If somebody come in and said, show me this, show me that, how confident are you that you could go, oh,
definitely. Definitely. Good. Okie doke. Right. What else would you like to talk about today?
I would, and please, anyone, go into the chat box again and tell us anything you'd like us to talk about. Otherwise, me and Pat will just chat away. One of the things
we can chat till 5.
Absolutely. So a couple of things. Just like to touch on pregnancy, risk assessments, and DBS checks. These are a couple of things that have been coming on my radar a little bit lately. DBS, I'm still surprised that, you know, going into practices or talking to practice managers, and DBS certificates are being photocopied or held on file, be it digital or paper. So that's
you just need a note of the DBS number, the disclosure number, but it's very important that the certificate is not that it's not kept on file. It's just the number that you need. And do you find that people are doing having DBS checks? Are most people using umbrella organizations to have it done automatically?
Yeah, most. And those that haven't been are starting to catch on to that. Actually, this is so much easier to do it this way. And just, asking people to look at, yeah, we get it done. If we have a new starter, we get it done. But there have been instances where, they've been, then it needs to be responsive, doesn't it, Pat? If
Yeah.
if you feel, if something comes on your radar that you feel that you need to have another DBS check with someone.
Yeah. Yeah.
I know when we had our inspection, we've got we have one dentist that just does pediatric RA. That's it. That's what she does, 1.5 days a week. And I know when we were inspected, they said, actually, do you know what? We'd like to see that you've looked at it and whether is it appropriate for her to have it more often than somebody else.
Yeah, absolutely. Well, that's what a risk assessment's all about, isn't it, when it comes to DBS? And also, there will be instances where people have perhaps, should we call it, lost their way when they were younger, and done things they shouldn't have done, drunk and disorderly and things like that. And actually, that may still be on their record, but what really matters is, does whatever is on the on record as being a criminal offence, does it impact this person's ability to do their job, number one? And number two, is it likely to be detrimental to the running of the practice? Because, say something like a misguided bout of shoplifting that was, some time ago. Does that mean that you think that somebody coming into the practice who made a mistake a number of years ago is likely to steal stuff? Probably not. But that's for you to make the decision. That's what it's there for. So I think it is. DBS started out really as it's a criminal records check, but also it's to do with, are there any things that in this person's history that indicate that they could be a safeguarding risk, for example. And I think Ian Huntley, the horrific murderer of Holly Wells and Jessica Chapman, all the signs were there, and what people who choose to do to abuse adults at risk and children do is they seek out employment where they can get away with these things. So, a dental practice would be a perfect place because you see adults at risk and you see children. So, the main purpose of a DBS is to make sure that there are no safeguarding issues. And if there are safeguarding issues, then you are well within your rights to not employ somebody. So, and this is really really important. But if there's been some kind of minor offence sometime in the past, and does that mean it's not going to impact this person's ability to do the job, and they're not going to be a danger to the practice in any way, and it's nothing to do with safeguarding, then the fact that they've got a criminal record shouldn't stop you employing them. Does that make sense?
Yeah, and there's a couple of questions from people.
Yes, there are.
I think it's, it's reassuring to know that, I mean, we've had things that have cropped up when we've done DBS checks on people, and it has been a conversation a little bit, to discuss it, and then a risk assessment to basically show we've considered whether this is going to put anyone at risk. It's absolutely not. We'll come to the questions. I just wanted to sort of put it out there. Just actually, me, I suppose, got a question for you, Pat. Is if somebody has had something happen, and Karen's saying, how often should we do it? Again, it's not something that you have to redo, unless you are concerned particularly. But I know that there's instances where something has recently happened. Say, for example, last August, there was an issue where somebody was in a little bit of trouble for being found asleep, drunk in their car. Now, that's obviously missed their declaration, the GDC declaration from July. And it's just, I'm just curious if they were, do they have to, I know that GDC says you don't have to tell us about traffic offence generally, but then it says you should tell us about traffic offence / other. And I'm just been in that predicament, is should the person be letting the GDC know? Do they need to let the GDC know? Or if they don't, is it the practice's responsibility? It's quite...
Yeah, if a GDC registrant has a criminal record, then that must be notified to the GDC. And if they've got a criminal record and the police were involved, then the police usually do the notification. But if somebody's got if somebody's got a is convicted of something and it results in a criminal record, then that must be reported to the GDC. If someone's found drunk and disorderly asleep in their car, then that's a health issue, and GDC registrants are supposed to self-report themselves to the GDC if they think that their health or their behaviours are likely to be putting patients at risk. Now, people who are drunk and disorderly, asleep in their cars at lunchtime, and then think they should be treating patients in the afternoon, clearly they shouldn't be. And so in that situation, then that is when you need to question whether there should be a whistleblowing to the GDC. Now, this is a really difficult thing to do, because the way I would handle it would be to talk to that individual and have a really in-depth, probably quite difficult conversation about whether they are fit and capable to treat patients. And obviously somebody who is drunk cannot be treating patients. And the big crime would be to treat patients when under the influence of alcohol or drugs. If that person says, oh, goodness me, this is the first time it's ever happened, it'll never happen again, I don't know how that happened, please will you cancel all my patients this afternoon, that's a different conversation. If they say, I'm absolutely fine, and I'm not making this stuff up, I'm absolutely fine, I always have a bottle of vodka before I come to work, that is not fine. And when I say I'm not making that up, there's a reformed alcoholic or recovering alcoholic who GDC registrant who gives incredible lectures, which I haven't ever been to, but my husband has actually, on addiction. And he literally would drink a bottle of vodka before he came to work every morning. I mean, it just terrible, sad case, but obviously putting patients at risk, even though he thinks he isn't. I think we need to distinguish between what's criminal behavior, criminal activity that results in a criminal record, and behavior that is unprofessional behavior that is putting patients at risk. And then, if anything, that's the harder thing to deal with, because the criminal activity is, you have to do it, there's no choice. But discussing with an alcoholic that it's not okay to come to work like that is a much harder conversation to have. I know I've gone around the houses a little bit with that one, but I think it's very difficult.
Do you know what, Pat? I've come across these situations more and more often since COVID.
Do you? That's terribly sad, isn't it? What a dreadful world we are living in.
If there are, I would reassure people there are groups out there. There are, if it's a dentist, there are dentist addiction groups. There's quite a few. There's which is a very good one. And I have had to signpost and help people find this help like more often than I would like. And it is terrible, but it does happen. But yeah, I think DBS, I think that's really
yeah. And we've got some questions on DBS as well here. So Julia's asking, is there any official rule guide about how often DBS should be repeated? Sadly, no. And you kind of have to make it up, make up your own mind. What I would recommend and suggest, which is not an official rule, is that you have it. I recommend that you go with one of these umbrella organizations, and then they just automatically do it at whatever period you specify. But I think I would not personally leave it longer than 3 years. This is a personal opinion, not an official guide or rule. And I think, I mean, DBS is a funny one, isn't it? Because Ian Huntley is a tragic and terrible example. The problem with DBS is that you can have a completely clean record one day and go out and be a mad axe murderer the next day, and it wouldn't show up because it's the DBS is no longer current. So really, DBS is only current on the day that you receive the certificate. But I think in answer to your question, is there official guidance? No, there isn't. The CQC, and I'm going to choose my words carefully on this, would probably like to see you not leaving it longer than every 3 years, or do it 2 years with a risk assessment. But the problem is the inconsistency in the inspectors. So you might get one inspector who, like Sarah says, or somebody said, Kathy said, DBS certificates in each staff folder. CQC looked in the folders to make sure we had the documentation. They shouldn't be looking for paper copies of what it says on a DBS report. So what you should do is view the certificate, take a note of the number, and hand the certificate back to the individual. That is what you should do. Whoever put that, Sarah put that, you're spot on with that. DBS, honestly, I do a lot of lectures on compliance. DBS nearly always takes up almost more time than anything else because it is so confusing. So it is a little bit of make your own rules up. Have a look on the DBS website. It is quite helpful. The other thing you need to make sure you do is that you make sure that the DBS is appropriate to the person's role. So all clinical team members should have an enhanced DBS. All non-clinical team members can just have a straightforward non-enhanced DBS, but it must be applicable to the that the person does. Does that make sense to everybody?
Yeah.
Any questions on DBS?
I do think it would be really helpful to, be quite open with your team about this. Maybe have it as a bit of a subject at one of the meetings. Why do you do it? Why it's important? How you store it? But also the importance of if there's any reasons why we need to be aware that things may have changed on your DBS.
Yeah.
You need to talk to us about it, and it's better to talk to us about it rather than us find out, because I don't know about you guys, but the one thing, the minute I feel like someone's not honest with me, I'm like,
absolutely. No, I completely agree with that. And then you asked about pregnancy.
Yes, it seems to be the season.
No, so Karen has said DBS reception and managers should be enhanced. No, they don't need to be. So it needs to be, go on the DBS website, it is quite clear on there who should have which kind of DBS. So it's only clinical team members that need an enhanced DBS. Sorry, Lisa, go ahead.
No.
Nurses enhanced, yes, because they're clinical, yeah.
So just being asked, advice on, I've got a pregnant nurse. It's just seems rife at the moment, to be honest.
Pregnancy or asking questions or both?
We all have that, you're so happy for your team when that your tribe's growing, but at the same time we also have that, oh my gosh, what am I gonna
I know
and we want to keep them safe, but from a compliant point of view, what can we do? And it does seem to be causing people quite a lot of problems at the moment. Instances over the last few weeks where other team members have actually grumbled that they feel discriminated against because they're not pregnant.
Gosh.
And oh, do you know what? You do
It
what?
is an absolute minefield, and I don't even feel I'm necessarily the best person to advise on this. Somebody like Sarah Buxton knows inside out what you can and can't do, but you do have to do a pregnancy risk assessment. Yes, absolutely, and you do have to make reasonable adjustments. But there are various cut-off points that I wouldn't be able to tell you off the top of my head when you have to do different things. So different weeks when you're supposed to do different things, and you know, I think you have to listen to a pregnant team member and see if there are, find out if they've got any concerns as well. You know, you might have somebody who thinks, oh, well, I don't want to be assisting when amalgam fillings are being removed, for example, because I've read that you know, it can be toxic, and I don't want to do that. Now, whether or not there's any scientific evidence for that, which there isn't, is irrelevant really, because that person is concerned about it, and you need to act on their concerns. So I think it is talking to them, finding out what their concerns are. You know, maybe looking at some evidence with them, seeing if they can be reassured, and if they can't, then you are going to need to find a way to accommodate their concerns. And you know, you don't need me to tell you that you need to be extremely careful, because otherwise you can get yourselves into all kinds of difficulties. So do a pregnancy risk assessment. Make sure that you know what the dates are for when people should be doing things, and what the employment law rules, which I don't know the detail of, are about when they can go off for maternity leave and come back, and all those sorts of things. It's really, really difficult, and I think my view would be that you need expert advice on it.
Yeah, no, absolutely. It's more for the you know, which roles they can do.
Yes, yeah,
Even during COVID, you know, pregnant mums could work pretty much as normal.
yeah.
During
If
that,
they were happy to.
yeah,
It
yeah,
always comes down to what they're happy to do. Because if you've got somebody who is convinced that if they catch COVID, their baby will suffer, then you have to listen. You have to take account of their feelings, and do all you can to help them
yeah.
at this time. So it's very, very difficult, and it's very, very easy to get it wrong.
I mean, for me, from a compliance point of view, I think it's those type of conversations that you want to have noted formally and recorded, be it like by email, or
Yeah,
you know, for those of us that have started to take advantage of audio notes to then
yeah,
transcribe into dictate that, you know, transcribe the conversation. We want to show that we're having the right conversations, because
yeah,
when we're dealing with anything that's kind of in that protected characteristic scope, as you say, Pat, it does become you're bordering on employment law and health and safety
yeah,
and
yeah,
all
yeah,
sorts of, and the
yeah,
moral side of it. You know, there's a
yeah,
lot to juggle with it. So I think it's really important that, you know, you do any conversations that are based, or any risk assessment based around the pregnancy, we are getting that formal, you know,
yeah,
professional advice.
yeah. Agreed.
Uh,
Agreed.
Thank you, Pat. So hopefully we'll see lots of lovely babies in a few months.
Indeed.
But yeah, no, it's lovely. It's just obviously as part of our job as managers to navigate
Yeah,
these changes and keep everyone safe. But yeah, it does seem to be quite prominent at the moment. Just one other thing that seems, oh yeah,
ooh,
Karen,
we just have.
yeah. Um, this is
Oh yes, everyone's favorite thing.
again, some practices
Oh
seem to
dear.
train one in. It's just
I know.
on.
Oh dear. Yeah,
Um,
which lovely news for your team member. Very frustrating for everybody else, it's difficult,
I
very
actually
difficult.
had a conversation with a nurse recently who she wasn't pregnant, but again, she was feeling a little bit hard done to because she was having to do this and she was now having to do that because she can't do it because of her bloody baby bump. And she was really quite, you know, quite put out by it, which
Yeah,
out was not particularly
yeah,
that we would like to feel is, going on in the practice. But and she said, and she lied. She knew she was pregnant when she was given the job. I'm like, I can't do anything about it.
yeah,
It's same as I can't do
yeah,
anything about it if they're spotted in the chippy when they're off poorly.
yeah.
All these things. It's
Yeah, absolutely. Now, Rebecca's asked a good question. Anything which we should be mindful of for miscarriage? I think if I'm reading you correctly, what you're asking there is there anything that could happen in a dental practice that could cause a miscarriage? Correct me if I'm wrong on that, Rebecca. Not to my knowledge, no. I think that if a pregnant team member says they don't feel comfortable lifting things, and again, you should listen to them. But in terms of is there anything in their job that could cause them to miscarry, then no. If I've misunderstood what you're asking, please just pop it in the chat line, because you could be asking if they've had a miscarriage, what should we do? Working just after miscarriage, yeah. Okie doke. Not, I again, it's straying into the realms of employment law, which I'm not the best person to answer on this. What I would do would be just a kind, caring, and empathetic approach, and sort of decide how much time that if they want time off, need time off, how much time you're going to let them have off, and under what circumstances, bearing in mind how incredibly traumatic it is. So, but I think I'm not the best person to answer that from an employment law perspective. Lisa, have you got any insight on that?
yeah, this unfortunately, and I know we joke about, it's sometimes we feel like we just got pregnant people and now we're going to have to find someone else and train them. I know, but there's a very sad side as well. Given the demographic of quite a lot of our teams, to be honest, it does crop up a lot. I was asked last year to do a practice manager's discussion on developing a miscarriage and bereavement policy. And you know what? There's nothing really official out there that is directly outside of the employment law side of this. But I felt it was a really good thing to do because bereavement and miscarriage, it's two of the reasons. If you've got a great member of staff or even not a great member of staff and you are supportive and you help them and you do things in a timely way that is appropriate to them, it's almost building that loyalty and that
definitely
culture of the practice. And I know that particularly if somebody helped me through a really difficult time, I'd be quite indebted to them. I'm not saying that you can stay forever, but I just think it's the right thing to do. And if you have a policy that, I mean, you're not going to stick to it 100% because,
no,
as I said, everyone's different. But I do think it's a common enough event that perhaps we should give a bit of thought into it and be prepared, so that we kind of know how to navigate it a little bit.
Yeah, I agree with you. And actually, I agree wholeheartedly with what Julia's saying. We've dealt with a few situations like this. And apart from being supportive, we also paid attention to any advice from their doctor. I think that's spot on. Spot on. There isn't really anything else you can do. And, there are no legal requirements that I'm aware of. But as I say, I'm not the person to ask on that. But I think just being kind, empathetic, caring, supportive, and yes, completely agree. Follow any advice given to them from their doctor.
I mean, everyone's everyone's grief is a funny thing, isn't
Yeah.
it? It's
Yeah.
everyone will be different, to say
Yeah.
that only have this time off if it's a parent. Well, sometimes
Yeah.
grandparents that are bringing people up, and I think you've just got to do what's right in
Be flexible.
yeah, absolutely, yeah.
Yeah.
I think I'm getting a bit soft in my old age, and it's like I will help them, support them, do everything.
Yeah, definitely. I would too.
Emotional with them.
Yeah.
Yeah, I just think, but I know there comes a time when we've got to be practical and go, but how are we getting the job done? It's been maybe 6 months. What are we going to do?
Yeah, sure. Absolutely.
That element still, yeah.
Yeah, definitely. I hope that's been helpful to those of you who are kind enough to bring that up. Thank you. I've got one I want to talk about.
Go on.
Nails. So the breaking news that is nails. Lisa doesn't want to talk about this, but I do. So there's this thing that's been running around on social media about some study that's been done that says there is no increased bacterial load underneath acrylic and gel nails. So it's fine for people to come in with acrylic and gel nails. Now, everyone's going to have to make their own mind up about this. HTMO 105 specifically says no nail varnish. Doesn't specify what kind of nail varnish. It says no nail varnish. It says
it's enhancement, isn't it?
Sorry?
It likes the word no enhancements.
No nail enhancements. That's good. So yeah, no nail jewelry. You can't have nails that are 3 feet long. But I think for me, irrespective of what HTMO 105 says, irrespective of what any study and bacterial report says, I think it's my personal view, and I'm prepared to be shot down over it, but
I'll join you.
Thank you. I think it's unprofessional. So I like wearing nail varnish as much as anyone else. And when I was in clinical practice, there were times when I went into work and I realized I hadn't taken my nail varnish off from nail varnish I'd had on at the weekend. And I had this, I almost had to sit on my hands actually. And it's in days of paper records. And I used to sit there trying not to let the patient see that I had nail varnish on, because it just felt and looked unprofessional in my opinion. And this is me talking about myself now. I think we have to remember it's not a beauty clinic. It's not a Instagram opportunity. It's a medical facility, and I think we have to do what looks and is professional. And then, of course, if you allow gel nails, because they don't harbor bacteria, but then other nail varnish does. How does that work? So how do you actually know if it's gel nail varnish or not? So I think it's a can of worms, and everybody should just continue, not must, should just continue with no nail enhancements and nails for nurses, dentists, therapists, hygienists, specialists should be short, clean, and free of enhancements.
I think, yeah, I mean, we might get called, a bit old school for this part, but I just think it's back to basics.
Yeah.
Gel nails. Well, I don't know. I'm a bit clumsy and I'm not the most, which is why I don't get them done very often. But my gel nails chip, they peel. It's how do we regulate it? If we're going to go, this is allowed, but that's not allowed.
Yeah, exactly.
As managers, we are then having to regulate that. And believe me, we know that we'll have to. It's like the old, phones. If you can have them a bit, when can you have them a bit? Where can you have them a bit? And it's just exhausting. And actually think you're opening yourself up for more chance of being accused of something like discrimination.
Yeah.
We have to regulate something like that. So yeah, these studies fine, but it's your practice at the end of the day, and you should be able to make that request if you feel it's the best thing for the practice.
Yeah, absolutely. We've got some questions here. So Julia says, I've got some nail varnish remover in the cupboard just in case anyone's forgotten. Great idea. Really like that. Gel nails they're not, my understanding is they're not false nails. They're just the varnish that gets put on. Can they fall off or chip? Yes. I mean, I've seen, I don't think they fall off, but what they do is they grow out and then they look even worse because, you know, you've got a gel nail that's halfway down your nail and it just doesn't look professional or hygienic actually. And then Lynn's asked a really good question. The employed staff adhere to the rule, but how would you tackle a self-employed associate? I think that it's the rules of the practice. So it's in the practice policy that clinical team members do not have nail enhancements. And the week before they go on holiday, no, it's no different to any other day of the week. And I think, you know, all associates should be signing a service agreement that says they agree to abide by the practice policies.
It doesn't, you know, we're supposed to be, we crow on about, you know, team culture, and I think, you know, there's certain things that we have to also, you know, it's the same with you know, watches, you know, watches, digital watches, where the wearing of those in surgeries in a clinical area, you know, it's like there's so many reasons why, you know, we need to sort of wobble our heads a bit, I believe, and kind of go, do we really need it? Do we really do that? I mean, we've had people who do a clinical stroke admin role who, you know, if they're going on holiday and they know that the, you know, am I going to be on admin for those couple of days? Because if I am, I'm going to go, nails done that. Yeah. Do you know what? We're not monsters. We can negotiate.
Yeah.
The thing I don't want to start negotiating on is Rimmel okay and is OPI not okay? Is it a builder gel? Is it a colour gel? Is it a make? It's just no.
It's fraught, isn't it?
I've got enough to do.
Yeah. I think it is. I am aware it's so circulating on social media at the moment, and but I think I agree with Lisa that it's down to each individual practice. Just bear in mind what it says in HTMO 105.
And can I just point out, you know, we've got 2 apprentices in our practice, and they go to a night class once a week. They have a hand inspection as they go into the classroom.
Really?
And call me old-fashioned, archaic, whatever you want to call it. I actually love that value. I just think
reminds me of being at school when they used to measure how far off the ground your skirt was.
Maybe that was just you, Pat.
I think so. Yeah, I think so. I was quite naughty.
I can imagine. I bet you weren't. I bet you weren't. Yes. So
yeah,
I think it's when it comes down to a few of the things with HTM, isn't it? You know, it's back to basics. It's not that we're not moving with the times, you know. It's just so we tried that. So Rebecca said we tried that, but when we had nurses saying, can I work on reception on day? I'm having my nails done. It opened a can of worms. Yeah, do you know what? If it opened a can of worms, Rebecca, if they're not going to be, you know, reasonable about it, I would say blanket. No. Would you, Pat?
Yeah, I'm not sure actually. We had a receptionist years ago who was always beautifully groomed, and her nails were not gel nails. They were always absolutely immaculate, and she always looked absolutely lovely. And actually, come to think of it, I didn't ask her not to wear nail varnish because she never ever went into the surgery.
Yeah.
But I think, you know, that's pre HTMO 105.
I mean, I think what Rebecca's saying is, obviously it's a nurse that wants her duties changed, so she can. I don't have any issue with reception wearing nails as long as they're only going to be on reception and there's no them needed to be gone into the surgery.
Yeah.
And again, I think it's worth talking to your team about it, you know, let them understand why and what it means. You know, they need to understand why we're saying this, because if they don't, they just think maybe we're just being a bit difficult. Or
Yeah, true. Yeah, true. And I'm sure it did open a can of worms, because, you know, then you've got the issue of nurses who are primarily clinical in their role, who may occasionally fill in on reception, who suddenly want to do a lot more time on reception because I've just had my nails done. So I think a can of worms is a very good description.
yeah, and can I just say, you know, I have seen that these sort of subjects, you know, that can be quite close to people, can be quite passionate about things, and if we, you know, sometimes go down these routes of trying to talk to our team about things that they don't agree with or don't understand, you know, sometimes it can go from not what the original problem started with, you know,
Yes.
where
Yeah.
it
Yeah.
can escalate into disciplinary, you know,
Yeah.
I've known people be suspended because they've refused to take them off. You know, if somebody is refusing to follow a reasonable request, is that, you know, what do we do with that as managers? Well, we kind of have to keep, you know, those conversations going. And if we do get people that are, you know, quite obstructive about it, it can end in dismissal.
Yeah. I know, and of course, you know, for you, Lisa, you've got such huge teams in your practices, and you know, it is even more challenging, I think. I do, you know, whereas if you've got a small practice team, well, that has its own challenges, but you know, trying to manage lots and lots of people with, you know, I want acrylic nails or gel nails or ordinary nails, or it's just, I think it's much simpler just to have a blanket policy, which is that we stick to what it says in HTML 105. Now, that's not going to please everybody, I know.
Well, you know, and if it's where does it end? You know, it's just things are hard, and sometimes I do prefer it when things are quite black and white, because from a manager's point of view, it does make things a little bit easier. And you
Well,
know,
yeah,
we're dictating, it's not, you know, there's just some things that we'll be willing to compromise on.
yeah, yeah, definitely. I think the other thing that I noticed, was very aware of in COVID, was that I was draconian about what must be done in COVID, because nobody knew anything about it. So I wrote all the protocols for getting practices back open again. And where I would have put should in the past in the policy, I changed it to must. And actually, must is a much easier thing, because should, people are always going to argue and say,
Yeah.
well, if it's only should, can I do it then? And I think personally, I think people like to know exactly what they can do and what they can't do. And otherwise you get these can of worms situations. So
Yeah, and I do think, you know, you are bordering on to getting into discrimination territory with things. People, someone's always more hard done to than someone else, and it's,
yeah,
we can just, I think we've got enough to juggle
yeah,
without
yeah,
that being
absolutely. Yeah,
personally.
absolutely.
Um,
Good.
we've come up to the hour.
We have. Any other questions? Thank you, everybody, for engaging so much. It's been brilliant.
Yeah, it's been really good. And as always, you know, myself and Pat, through Adam or through dentistry, are always happy for you to come to us if you have any
Yeah,
questions.
absolutely.
I think actually, interestingly, we've got an Adam webinar coming up in a couple of weeks for the association, where Sarah Buxton from Buxton Coat Solicitors, our wonderful friend, who we're having a bit of a reunion at the Manchester, no, north of
Yeah,
England
North
Dental,
of England. Yeah, yeah,
north of England,
yeah,
next Saturday. I think we're all doing a panel.
yeah.
So yeah, it's like a little mini reunion for us.
I know.
The webinar, Sam will, I think Sam's about to release the date for that. I think it's in a couple of weeks. And I will pick up with Sarah about some of the things that have bordered on the employment law.
Yeah, yeah, brilliant.
which
yeah, that's great. And Sarah's asking us, I'm new to Adam, how often are these webinars run? Well, Lisa and I call them, Lisa and Pat have a chat, and as you've seen today, we just talk about what everybody wants to talk about, and sometimes we talk about what we want to talk about. So they run mostly every month. We're doing another one in a month's time for sure, and I guess we'll just keep going with them.
I think we've given dates for quite a few months ahead.
Yes, we have. Yeah, I think so.
And the Adam specific, we've got other Adam webinars that Sam normally posts out. And we invite some other lovely people like Sarah Buxton, and just lots and lots of different topics. But one topic that no one's ever going to get fed up of getting advice about, Pat, is hours and compliance.
Good. I can talk for endless hours on compliance.
Kathy Smith's coming to the Manchester show.
Brilliant.
Yes,
brilliant. Make sure you make yourself known, Kathy, and anybody else coming into Manchester as well. I seem to be speaking 4 times in Manchester, so I'll be talked out by the end of the day.
I think, yes, well, Adam has its own theatre, and they've given us a theatre, so we decided that we want to cover lots of different topics. Compliance being one of them. We've got employment law, we've got some more financial diary based, how to optimize things. We've also got accountants, we've got solicitors, we've got actual real people from real practices. I wanted to make sure that we did these wonderful experts such as Pat, but also people like us that are on, doing in the practices every single day, which I think is a wonderful balance, which is
I do too.
Chats as well. But please do come and say hello. Adam's got his own theatre, we've got our own stand. I'm going to be hosting and taking Q&As to give to the panel all day. I didn't realise I was doing it all day.
I know, all day.
It's going to be great. It's going to be great.
It's going to be great.
Karen will see you at the NEC in May.
Yes, I'll be at all of those things. So, if you see me, then please say hello. And I'll be on the dentistry. When I'm not speaking, I'll be on the Dentistry Compliance stand. So come and say hello to us there.
That would be, I'm really looking forward to it. I'm also looking at my diary for March going, oh my goodness. It's like,
I know there's a lot on, isn't there? A lot of
dental shows, but it'll be really, really good, and a nice little flurry before Easter.
Yeah, brilliant.
But please come to us. Anyone that isn't an Adam member, please do speak to us if you want to become a member. Pat, if anyone wants to get in touch with Dentistry Compliance, book a demo. That it is fantastic, genuinely fantastic. Which
thank you. I haven't paid her to say that, by the way.
You can buy me a wine one day, Pat. Buy me a wine. That's fine.
Great.
We use it, and we love it. So thank you, everybody.
Thank you. Thanks, everyone. Thanks, Lisa. Thanks, Sam. Bye. Bye.